Hello, my name is Jennifer Basson. I'm the professional practice lead for Child Life and Creative Arts Therapy at Sick Kids Hospital. Today I'm going to be talking to you about child life tricks of the trade and providing you with some tips and strategies on how you can make procedures go more smoothly for your patients. Please take a moment and review this disclaimer, and then we'll get started. In this presentation, I'm going to talk about strategies that you can use to support pediatric patients and make medical experiences easier for them. Sometimes it takes a little bit more time up front to incorporate these strategies, but in the long run, you set patients up for success, not only in the procedures happening in that moment, but in future procedures as well. Let's start with the ABCDs of behavioral distraction. These techniques turn a child's attention away from the procedure and onto something more positive, supportive, and relaxing. A stands for assorted visuals. These provide a visual distraction, drawing attention away and engaging a patient in a fun activity. These can be various kinds of toys that do something interesting, like this light spinner, but it can also be a tablet or a caregiver's cell phone. B is for breathing, and coping through breathing is always helpful, as it helps kids stay calm and in control. There are different ways you can encourage deep breathing, such as having a patient blow bubbles, or if you don't have any, you can have them blow objects that you have on hand, such as gauze or a tissue, or even blow out imaginary objects. Hold up your hand and pretend that they are birthday candles, and tell the patient that they need to blow out all the candles. As they blow, lower your fingers. Singing is another way to encourage calm breathing, and it can be done in a mask, which is great. You can have a sing-along with the patient, their caregivers, and staff, and it will reduce everyone's stress. C is for comfort measures, which are interventions that provide physical relief from pain and anxiety. Remember, children have difficulty distinguishing between pain and fear or anxiety of pain. So if they say something hurts and you haven't even touched them yet, they are likely feeling very nervous and need some support around that before the procedure can begin and go smoothly. Comfort measures include things like warm or cool packs, warm blankets, positioning, or therapeutic touch. There are things to consider, though, when providing comfort measures, such as what is the environment like? Is it very loud? Is it very cold? Is the room very bright? What position are they in? And is there one that will help them stay more calm and be more comfortable? Who is there to support them, and what role can they play? Did they bring a special toy or stuffed animal with them that is in their stroller, or is it just out of reach? You'll want to move that closer to them so they can use it for comfort and to feel safer. Diversional talk are words that change the focus of attention, and it's something that any of us can do. Ask patients questions. What's their favorite movie? If they could be any animal, what would they be? If they aren't feeling very talkative, you can be the talker. Try telling them a story that uses imagery in all 5 senses. So maybe you can tell them about a vacation that you went on, where you went to the beach, and it was so cold that day that your teeth were chattering, and when you put your feet in the water, they got so cold. The birds that were floating on the water were probably cold too because they kept making the loudest sounds. You really want to immerse them in the imagery of the story. One thing to remember, though, is too many voices equals too much noise and a chaotic environment. So you want to choose someone to be the talker, someone to be the one who asks the patient questions so that there's not multiple voices going on in the room. Distraction techniques are not created equal, and you have to figure out what might work best for a patient. Factors to consider are what is the child's age, and more importantly, what is their developmental level. What is their preference? Ask them. Ask their caregivers. Is it doable in the environment that you are in? And are caregivers available, and do they have the capacity to provide that support? This should all be discussed and determined before the procedure starts. Some tips on how to use these behavioral distraction methods. You want to help the child make choices and the use of the distraction methods. It's beneficial to discuss and rehearse the use of the distraction tools during moments when discomfort and anxiety is controlled or minimal. It's important to remember that distraction is the active diverting of the child's attention, not tricking the child, but inviting the child to shift their attention onto a chosen, interesting, more pleasant physical object other than the painful procedure. So I'll often ask a patient, are you someone who likes to look at what's going on, or would you rather look away? here are some things that I have that you can look at while the procedure is happening, but you never want to deter them from looking at what's going on if that is what's actually going to make them feel safer and more comfortable. Here are some other things to remember. You want to share age-appropriate information and time according to the needs of a child. You're going to share the 4 W's. That is the what is going to happen, when is it going to happen, where is it going to happen, and why is it happening. It's important to be honest and tailor the explanation to the child's coping style. You want to give choices if and where possible. So it might not be a choice if the patient has blood work done, but you can give choices that will make them more cooperative with the thing that's not a choice. So you can't choose if you have blood work done, but you can choose. Do you want to sit on the chair? Do you want to sit on the bed? You can choose what distraction techniques you use. And you want to avoid lying or withholding information to protect the child or because the child doesn't cope well. This will make them less likely to trust in the future. And remember, language is powerful and choice of words is important. Along those lines, here are some things to avoid. Don't say it won't hurt, even if it won't. Again, kids confuse anxiety and pain. So if they are worried it will hurt, it might feel like pain to them. I just avoid responding to anything when they ask even, will it hurt? Saying yes or no. I really want to find out what the experience was like for them when it's over. So I might say, do you know what? I'm not sure what it's going to be like for you. Some kids say that it doesn't hurt. Some kids say that it feels a little bit warm or tingly. When we're done, you let me know what it felt like for you. You don't want to use medical terms without explanation. Medical terms are confusing for kids. They're confusing for adults who don't work in the medical world. And I think that those of us who do work in hospitals get used to the terminology and we use it without thinking about it. But it's important to not confuse patients and families by using medical terms and not explaining what it means. Providing excessive reassurance. It's okay, it'll be all right, you'll be fine. Eventually that excessive reassurance starts to lose its meaning and its power and isn't helpful. Apologizing. You don't want to say, I'm sorry you have to go through this. And the reason is that you're not doing it to them because you want to be doing something painful to them. It's something that has to happen. So you don't want to take responsibility for something that you are not choosing to do, but you are just doing what needs to be done. Criticizing. We often don't hear, well, we hope that we don't hear hospital staff criticizing, saying to a patient, you're being a baby or you need to be braver. Sometimes we have to, when a caregiver is saying these things, we have to try and redirect to other things. Threatening. If you don't hold still, I'll have to use another needle. Now, it might be true. If they are not able to hold still, you might need to use another needle, but you don't want to threaten if you don't hold still. Just say, it's really important that you stay still so that we can get this done quickly with one needle. And also parental anxiety can cause issues. Involving parents and caregivers can be really beneficial if they have the capacity to be helpful. They can provide support and reassurance to their child, but if they themselves are overly anxious, children usually pick up on that, and then everything goes south. So you want to assess a caregiver's willingness to participate. There are some caregivers who know that they're just not good in these situations, and so it's helpful to give them the permission to not be present for things that cause their child discomfort. You're going to educate parents and caregivers about behaviors that promote coping. You're going to remember that parents are experts in their child's life, but not necessarily in how they react in medical situations and what might be helpful in their coping. So you'll work together to figure out what is going to be the best way to support their child. You're going to give them tasks that allow them to be helpful for their child. So if you want to involve storytelling, then maybe the parent can tell the story to the child of the last vacation that they went on, or other stories that the child really likes hearing. The next thing we're going to talk about is comfort holds. The goals of comfort hold are a secure, comforting, hugging hold. It provides close physical contact with the parent or caregiver. The caregiver participates in positive assistance, not negative restraining. The sitting position that can be used with some of these comfort holds can promote a sense of control. Immobility of extremities is extremely successful with comfort holds, and fewer people are needed to complete the procedure. Positioning for comfort has been evaluated, and it was found that as children become more comfortable during procedures, healthcare providers were also more relaxed, interactive, and supportive with their patients. Parents realized a role in supporting and comforting their child, and it's a role that's integral to the team. Children who are calm before a procedure will react with less intensity than children who are upset for other reasons, such as being restrained or held down. And even lying down for a procedure can be frightening and feel like a loss of control. So if you think about as an adult, if you went into an emergency room and the first thing that they did is put you down on a gurney and held onto your arms and your legs before they did anything, you are going to panic. And the same thing is true for a child who is put down on a bed and held down for a procedure. So we really want to take opportunities to use these comfort holds that feel a little bit more reassuring and comforting. So there are different holds that are more suited to different age groups, but you usually can find a way to use any of these holds for different age kids. This one, though, is really common for babies, these two. There's the swaddle snuggle and arms at midline. You can take a look at these diagrams. The swaddle snuggle is best for babies who aren't sitting up yet. Arms at midline used for babies who can't be picked up or adjusted during the procedure. The laying beside the baby, and you'll see other comfort holds in the coming up slides where it's older kids who still get to have this laying beside. It maximizes the contact because they're right beside each other. They can breastfeed, they can swaddle the baby. There's minimal movement. The caregiver can cover the child's feet or arms with a blanket. They can leave an arm or leg out depending on what extremity is needed for the procedure. For the arms at midline, they can hold the baby's arms and hands to their chest. The caregiver wraps their arms around the baby's feet at the same time to avoid kicking during the procedure. And these can be really good for anything like blood work, IVs, sutures, NG tube insertions, and P swabs. For toddlers and school-age children, we have our bear hug, chest to chest. This works really well for kids who need distraction, and they can either choose to watch the procedure or look in the opposite direction. There's more comfort and protection if the child's anxiety levels rise while still allowing control of sitting up. It can be done on a bed or an exam table. And the chest-to-chest contact allows the child and caregiver to hug each other. The caregiver can keep the child's arms still, they can keep the child's legs still, but it's done in a way that just feels like they're hugging them and keeping them close and safe. If the child does prefer to look away, the caregiver can secure their head with their hand to keep them from looking back at the procedure. The kangaroo hug is similar because it keeps the child immobile and there is close contact, but it allows for back to chest contact. It can be really good for older kids who want to be independent but do need to be held. It can be done on a hospital bed or a chair. It allows the child to be hugged from the back. The caregiver can hold the child's arms. They can use their legs to hold the child's legs. It can be done on an exam table, as you see in the picture. And if needed, they can also secure a child's head with their hand on their forehead. For school-age children and teens, they can be sitting up in a chair or on an exam table. For school-age or teenagers who want to have some sense of control or ownership over the procedure and it's safe to do so, it's good though to have a caregiver nearby. Sometimes I see, the kids will be sitting on the exam table, they'll be sitting on a chair, and the caregiver is on the other side of the room looking at their phone, not involved at all. If they do feel like they can be present for the procedure, having contact with their child can be really helpful. A hand on their arm, on their shoulder, holding their hand, just making them feel reassured. For the side sitting, same thing, it's just the caregiver is sitting beside the patient. And again, they can use their arms to hold the patient's arms still. They can use their legs to hold the patient's legs still. Remember, these are all about making sure that kids are safe. They're not kicking, they're not flailing their arms, but it's done in a way that feels comforting and reassuring as opposed to restrained. So if you're using these comfort holds, you still want to utilize all the different distraction techniques we've talked about because they really work best hand in hand. And the best distraction tools are toys. You want to connect with your hospital's infection prevention and control department to confirm guidelines around what is allowed in your institution. What toys are allowed in with which patients will depend on patient's type of isolation, if any. Toys need to be made of a wipeable, non-porous material that can be cleaned with Virox or other hospital-approved wipes, and they need to be cleaned after each use, and they cannot be shared between patients unless sanitized. This is a comfort kit. Comfort kits are things that you keep on hand so that you always have something to support patients. So patients sometimes need help to cope, help to relax in the medical environment, and the toys and tools in the comfort kit can be used to help the child focus on other things. So all the things we talked about, you would have things in your comfort kit, so you don't have to go searching for something. Again, anything a patient touches would have to be cleaned. I suggest taking a few things out of the comfort kit and using it with the patient, and then you can clean it before you put it back. Here are a few resources that we have at SickKids. We have our About Kids Health website. This is a SickKids website that can be a resource for hospital staff, caregivers, and patients. There's a huge array of information with age-appropriate sections. So there's one for adults, one for teen, one for kids. And there's also an About Kids Health YouTube channel. We also have a YouTube Scoop channel. Scoop is the SickKids closed circuit TV channel, and programming is shared on YouTube. It's a great resource for learning techniques, and it can be shown directly to patients. There are some really great videos on there about how to do deep breathing, how to calm yourself down. Lots of great resources. Thank you. If you have any questions, either about the presentation or on ways that you can support patients in the hospital, please contact connectedcare.inquiries@sickkids.ca.